Welcome to Beyond the O.R. with Dr. Kevin Brenner. I'm a board-certified plastic surgeon in Beverly Hills. I want to take you beyond my world of plastic surgery, diving deep into exciting hot topics and delving even deeper into compelling characters that I've met along the way. We'll be talking with attorneys, actors, comedy writers, Navy SEALs, and many other fascinating and inspiring people with truly intriguing stories to share. So let's jump right in. Welcome back to Beyond the O.R. Today, as you can see, we already got started. We have a very interesting show because we're talking about IV hydration, peptides, IV therapies, and we have with us the founder and co-founder of Alpha Hydration, Dr. Jonathan Prince, Nurse Dwayne Mariner. These guys are pros in the world of emergency medicine with over 15 years of experience, work in emergency medicine, doing pediatric and adult trauma, and all things related to ER medicine. And now they have shifted focus to health, wellness, longevity medicine, and IV hydration and peptides. And I'm so excited because this is what I've been immersing myself in for the last year and a half personally. So it's great to bring them in. These guys are experts in this field, and to educate you all. So Dr. Prince, Dwayne, welcome. Good to have you guys.
Thanks for having us.
Elizabeth's been telling me about you guys for a long time.
Oh, yeah.
And it's good to finally have you in. As you can see, we already kind of pre-hydrated for this show.
We have IVs going.
Yep, we're all.
Dr. Prince and I both have, is this a 20 gauge in our Anacube fossa here?
This is correct, yes.
We have a little, tell us, Dwayne, what do we have currently infusing into our venous system here?
Basically, it's colloquially called the Myers infusion. So we have magnesium, calcium, vitamin C, B complex, which is 5 or 6 B vitamins, B12, and then we did a glutathione IV push, which is a huge antioxidant.
And a big recovery drug, right?
Huge recovery drug.
That's what everyone's telling me. That's what I'm reading about the glutathione.
Yeah, oh yeah.
It's magic.
Yeah.
Absolute magic. Yep.
It really detoxifies everything.
So I want to start with, let's just kind of back up a little bit before we jump into the IV stuff. I want to get your background because you both are kind of ER trained, right?
Right.
You're a Pittsburgh native, and
Go Steelers.
Go Steelers!
and then went to New York for med school, or Cornell for undergraduate,
Right.
Tel Aviv for medical school, and then back to New York for your residency in emergency medicine, correct?
Right, correct.
And you, Dwayne, are a Texas native? Do I
I'm a
have that?
Texas native.
Okay,
yeah.
so
Okay, you can't tell.
How did the two of you cross paths? Tell me about your training background, and you went to nursing school where?
I did in West Texas, actually. West Texas A&M University, go Buffs. It was a choice of two, Emerald College
Is this
or
going to
West
be a
Texas.
sports show?
I
don't understand.
Decided I didn't want to be an oil field worker anymore, and I needed something a little more dependable. And said, okay, I'll go into nursing. Did that, started doing ER stuff. Me and my wife got married, went travel nursing, wound up in LA in 16, met Dr. Prince. Short story, we came across somebody who said, do you know how to do these IV things? We're like, no. Told Prince that we're going to do IV. He said, okay, let's do it. That's it. That's about the history.
And how did you work your way to Los Angeles?
Got married, moved here. My wife grew up around here.
Oh, she's from here?
Yeah, she's from here. So
And then
we
you-
both trained in New York and then moved out here.
And then you went straight to Providence?
I worked in a few different emergency rooms in around LA, and then eventually settled in. And I was exclusively the night doc for about 15 years. So with all that, what comes with it. So yeah, one night, Dwayne.
You mean the sleep deprivation and the shitty eating habits?
And
Yeah,
then
actually, the eating. I made it a point to do good eating and good sleeping, but yeah, it takes a toll over time.
Kills your circadian rhythms.
No, this much I know. I've done
Yeah.
enough overnight.
You've done a few of them, yeah.
So did you guys met at Providence?
Right.
At Providence.
Okay.
Yeah, we were working together, and one night Dwayne said, "What do you think about this idea of doing IVs?" And I said, "Okay." And then the next night I came into work and I started picking up charts, and he said, "Hey, give me your wallet." And I said, "Okay." And that was it. You need
That was
Everything
it?
I can financially ruin you with, and let's go into business.
Yeah, and we just started the paperwork, and what we thought we were going to do was go to races, festivals, things like that, and do this kind of work, and that's just not the market as much for it. The market is much more in wellness and recovery and things like that.
It seems to be now, yeah.
Yeah, so it became clear pretty early on that was really where the market was, but also where the interest was, and where you could really expand your offerings and really do the best work.
What year did you guys get Alpha Hydration off the ground?
18, February of 18.
Okay, that's interesting because what I noticed was right around the COVID shutdown is when everything kind of exploded. Like everyone, at least for me, like my practice was shut down for several months by the city of Beverly Hills, and lots of other physicians they just took it offline, and they just were doing, people were just started doing IVs, therapies and stuff, and
Wellness.
I guess I missed the bandwagon. I don't know.
Well,
yeah. But yeah, so that's where it kind of exploded, and then I'm just as my breast implant illness practice has exploded, I've just begun to rely a lot more on alternative therapies and partnering with alternative practitioners.
And you've seen that shift. You've seen that shift from reactive, for lack of a better term, reactive medicine to more this preventative wellness approach, and it just keeps continuing to shift that way, where people are like, "I don't really want to go to the doctor anymore. I want to be proactive." We're like, "Great, let's be proactive," which I feel like with the breast implant and all that is essentially a proactive approach.
In some respects, but yeah, the just IV therapy, doing it mobile, which is super helpful, right? Because it sort of expands your footprint. But it's not just hydration, even though IV hydration is important. Like, what other services are you guys offering? Because this isn't just about getting lactated ringers or normal saline.
No.
Right?
We have a half a dozen or so sort of not pre-mixed, but pre-designed infusions, but then we adjust on the fly for whatever anyone's specific issue is, whether that be a problem with one sort of additive or a requirement for more one additive, so we can change it up per whatever people need.
So we could do, like for instance, COVID. We did thousands of antiviral drips for COVID. Probably kept tons of people out of the hospital that called us in time to actually have some mitigation. We had a handful, called too late, super sick. Not much we can do for you.
So let's go. I'm glad you brought that up because I got COVID back in February for the first time in 3 years.
Wow.
Right? I went last.
That's a pretty good record.
Yeah, it's not bad.
That's pretty impressive.
Yeah.
And I did the same thing. I had an IV infusion, and I think like 24 hours I was really almost completely asymptomatic. It was also a tamped down virus strain, so I'm not
sure.
So, but I was going to say I wanted to just go through a couple scenarios. What were you gonna
Really
say?
quick, I just wanted to interject that they kept me alive. That's what I say. They kept me alive during my pancreatitis. Kim and Dwayne would come to my house sometimes at midnight, 11 o'clock. I was so sick, and they would come to the house and just take care of me. And then after BII, after the explant, they came and did detox, metal detox IVs and stuff like that. So you guys, I appreciate you guys so much. You really, really, they kept me alive and out of the hospital.
Well, with pancreatitis, the number one thing is bowel rest and not eating. right?
Yeah.
Because anytime you eat, it stimulates pancreatic
right.
enzymes and just makes it worse. So
Couldn't
you
eat for 7
That's the
days.
only way you can stay hydrated.
Yeah.
With
And it was a
IV.
holistic approach with Elizabeth. It was a holistic approach. It was body, mind, spirit. It was everything.
It was.
We tried to balance it all with her.
Yeah, because I'm high maintenance. I don't know if you know.
You're not high
No,
maintenance.
no, I have not noticed that at all. Okay, so let's kind of go through, if you will. This should be easy for you guys.
Sure.
A couple scenarios, not the board exams.
All right.
The IV board exam.
I'm going to take C. I'll take C.
So since you mentioned it, someone with bad upper respiratory, COVID, or similar flu virus, what do you got in your armamentarium?
Depends on severity. If it's early stages, I would do like an immunity booster, which has all of the ingredients, kind of a dialed back version, mostly the hydration, kind of flush everything out. If it's already transitioned to more severe, I'd go with our antiviral because it's got a high dose vitamin C, 15 to 25 grams, depending, and it's a sledgehammer. So it essentially hammers that virus, keeps it from replicating. So once we can dial that virus back from replicating, then they start getting better quickly. If it's super involved with the respiratory system, we may or may not do like a Decadron, something to reduce the inflammation. Nothing too severe, but
What's amazing is, the real, let's say, for instance, vitamin C, right? Everyone takes vitamin C when they get sick, but you can only realistically take a certain amount of vitamin C,
Yeah.
by mouth.
Because you
a
just
couple grams.
well,
First of all,
and you just pee it out anyway.
right.
It's not-
So number one, it's gonna flush. Number two, it's gonna tear a hole in your stomach. You can't take 5,000 milligrams of vitamin C 3 times a day. I mean, you're make yourself sick. But what you really need in your bloodstream is that high dose of vitamin C to basically make an inhospitable environment for viral replication, really get the true antioxidant effects and all those things, and you just can't get that. Your body's just not going to absorb, you're not going to get the bioavailability from oral vitamins. So being able to do that into an IV really tamps down the ability of the virus to sort of get a foothold.
Right.
Plus, like you said, you do get 100% bioavailability, which I glossed right over.
Right. So you're by bypassing the GI tract, you take away a lot of the side effect issues as far as GI upset, and then you also get the real high-powered antioxidant effect in the bloodstream.
And then let's talk. So that's dose. Let's talk frequency, right? So how often, if someone's got a bad upper respiratory infection, as we mentioned, how often should they be getting an IV?
It depends on the person, but there are people that will say, I want to have you guys come to my house every day. I'm not feeling good. And that's silly. Obviously that sounds terrible from
And
the,
I would tell them that, though.
Well,
That's silly.
is
You
it
don't need to go
silly
that
because
often.
is it silly because it's stupid expensive and unnecessary, or is it silly because it's too much?
it's too much. I mean, I don't know that it's
And you gotta
stupid
let
expensive.
it
but-
work for a minute.
Right.
Let it marinate for a bit to do its job before you start throwing more at it.
Okay.
Right.
Good to know. Are you taking notes, Elizabeth?
I am.
Okay. Okay. So that's
Mental.
that's kind of scenario one. Scenario two, and I'm asking for a friend.
Right.
I've never seen this happen, but suppose someone's at, I don't know, a 50th birthday party.
Right.
Maybe a bar bat mitzvah.
Never happens.
A
Right.
wedding, right?
Right.
And they get completely shit-faced.
Right.
The very best thing is IV fluids.
Absolutely.
With big
Oh,
complex.
yeah.
And now
Big
I've
complex.
read about this.
Yes.
Yeah.
Right.
Yeah.
So
I saw it on the internet too.
Right.
Yeah.
I've
Yeah.
experienced
I've
it.
heard. I don't.
So,
Yeah.
I don't
so
recall if I
now,
ever used it.
now here's my question, because
Right.
it's usually like 1 in the morning, maybe midnight, 1 in the morning, 2 a.m. when people are really at the peak of their drunkenness, right?
Right.
Yeah.
Which is probably the best time for them to get IV fluids, right? But that's
theory.
not when you want to get called.
No, we don't do late nights like that anymore. When we were starting out, we did. We were known to be out, at 1, 2
You're
o'clock
like, that's
in the
why I
morning.
left the ER.
Right.
yeah.
I will say this, though. We do make reservations So it's not unheard of for us to roll in on a Saturday or Sunday morning, having been, if you had this theoretical birthday party event,
Right.
And said, I anticipate there may be a problem. My friend thinks there's going to be a problem the next morning.
Right.
That friend, could call us, and someone could be there, 8 o'clock in the morning, so that by lunchtime, they actually have a functional Sunday as opposed to not.
But
And also-
yeah, go ahead.
Also, they have celebrity clientele that musicians, all different
Elizabeth
types of.
Morales.
We have
That's right.
Yeah.
we
And-
can't discuss, specific clients, but
Yeah. Exactly.
She already owned up to it.
But so they, they have had to prep somebody before a show, or
Gotcha.
Yeah, there's been a lot of odd scenarios, but yes, on the party side, the overindulgence. Most people don't make that decision till the next day. They feel great when they go to bed.
yeah. And then they
And
wake
they wake
up.
up and go, whoops.
That's true, but we're all professionals here, so let's get down to it.
Yes, we are
So
professionals.
alcohol, as we learned in medical school,
Yes,
right,
we did.
is extremely dehydrating, right?
Right.
So you think you're drinking all this fluid, but it's much akin to drinking too much coffee, right?
Right.
It just stimulates your kidneys to just completely
Flushes you right out.
Right.
Yeah.
And so you get, it's not just the toxic effect of the alcohol, it's the dehydration primarily, I think, that makes people feel so bad the next day. And if you can, would you agree that if you can prevent the dehydration, that the hangover effect is going to be less, right?
You can. I will. Speaking of friends,
Right.
it has been told to me that if you prepare too much, you may not actually get the benefit of your indulgence, if there is one.
Right.
So
Quite the
that's just.
Well,
dichotomy
I'm
there.
not
I
talking
love all
about.
these hypotheticals.
I'm not talking about someone potentially pre-hydrating without the fluids.
Right,
I'm
right.
just saying, like, before you go to bed, maybe.
Oh yeah, 100%.
Right, yeah.
100%.
Especially if you have access to it,
Right.
Right. Well,
which
some people
luckily,
Yeah.
but we don't
might. If you own an
overindulge.
operating
so-
room, you might have some IV fluids laying around.
Occasionally those
Yeah.
things happen.
Okay, so that's great. But then the morning after, as soon as you can get hydrated, you would say the quicker people are going to start feeling better.
Absolutely,
Right? All right,
absolutely.
And then what's going into your post-apocalyptic IV infusion for alcohol toxicity?
So usually that one is going to be, we go heavy on the fluids, B vitamins, magnesium. We can put in more of our antioxidants and our immune boosting additives, but generally we lean heavily on the B vitamins and the magnesium, and
Antiemetics if necessary.
and then if necessary we have
Little Zofran.
little Toradol,
If they
headaches.
need a little Western stuff, we do some Western stuff.
Right.
Gotcha. Okay. Do you have any questions about that?
No,
No,
I
I
lived
mean-
it all.
Yeah.
I've experienced.
But not for that reason.
Tequila is alcohol, by the way.
That's
yeah.
my truth serum.
Yeah.
It's a.
As he found out.
It
I
is.
thought it was
Perfect.
It's one of
The vault
but
is
it's one of the
open.
food groups. They've just
Yes.
just changed the pyramid,
Yeah,
and that's
it's
one of the
completely
food groups
different.
now.
Yes.
Okay.
I agree.
So I thought I read that.
All right, scenario number 3, which is probably the also one of the more common ones, is any form of gastroenteritis. I don't know if pancreatitis kind of is in that realm, but
Right.
GI bug, gastroenteritis, food poisoning.
Right.
Right. These are all not terribly uncommon. I myself have been the victim of all of the above. In fact, in medical school, I got hepatitis A from our hospital
beautiful.
cafeteria,
Wow.
and I was the index case in the emergency room, so they didn't even know when it came through.
Zero?
I was not patient 0. It was the cook in the cafeteria who was patient 0.
Patient
But yes, I was the first one that was diagnosed. It was right before my first
stirred his mashed
anatomy
potatoes with a finger.
midterm. So can you imagine like going in feeling like that into a
Oh,
cadaver
terrible.
lab? Yeah,
With
well,
no excuses.
it was
Yeah.
not fun. And then there were like 15 employees and medical students from the
Everyone.
program got sick like in the next couple days.
Oh.
Yeah, that was not fun. So like for how would your cocktail shift for someone with bad either vomiting, diarrhea, general gastroenteritis, right? Because you have a lot of potassium loss.
Right. So we're going to lean heavier on the electrolytes and the amino acids, and also actually the antioxidants and the immune boosting stuff. We actually do a little bit heavier on that as well, because you really see you really see, in addition to all of the losses, both the fluid losses and the electrolyte losses and all of that, you're also seeing the body in a very inflamed and over-aggressive state, trying to address this acute issue. So we tend to sort of modify our immune boosting to lean more towards electrolyte and fluid replacement, but still maintaining that immune boosting.
Potassium's a tricky one.
Yeah, it is very tricky
You gotta supplement unmonitored out of a hospital setting, so it's lower doses if we do it, because it's
Right.
it can cause.
But
so many different
LR
things.
has enough to kind of keep
Right.
you on
Yeah,
the track.
we do a lot of LR, which I feel like is
So and then
supreme for that.
so I was just coincidentally I was recently in Mallorca, and my wife got food poisoning when we were in Mallorca. So this was fun. So it takes a lot for me to either go to or bring someone to the hospital.
Oh yeah.
Kicking and screaming.
But
Yeah.
in this situation, I was like, this is not going to be good. So I ended up eventually biting the bullet and taking her to the ER to get hydrated. And what a lot of people don't understand is that it's like this terrible feedback loop, right? You start throwing up or having diarrhea, and you get dehydrated, and it just makes your nausea worse.
Right.
And the dehydration and which is common even with being intoxicated,
Right.
right? The dehydration is what makes people so
Well, that
sick.
ketosis and that sort of high ketone body load, if you're not habituated to it, just makes you so sick. That's that same thing with pregnant ladies and hyperemetics. We actually have a handful of OBGYNs who will have us see their patients out of the hospital for hyperemesis, because they just don't, they have to get through however many weeks it is until they sort of stabilize out, and they just don't want them to constantly be having to go back and forth, to a hospital
So
for that.
layman's terms, what is
Hyperemesis gravidarum is basically very bad morning sickness.
Okay, gotcha.
which generally takes place in the first trimester, right?
Right.
So you
That's
can
first
get
12
so you can actually hydrate pretty well and not fluid overload them. 'Cause
Correct.
In the end of the second, into your third trimester,
Then you get
you're
in-
gonna
right,
start,
very
you're gonna start
tricky.
fluid overload. 'Cause
Very
they're already
tricky.
fluid overloaded.
Okay,
You've been a mom, you know.
I know.
I can count on
She still
one
is a mom.
finger how many late pregnancies we've had
been a
to deal
pregnant
with
mom.
that.
Yeah, I'm gonna-
Fantastic. All right. Are there any other scenarios that we left off the table?
I don't think so. I think we covered them all.
I think for
Doctors at podcasts.
yes.
Yeah.
Very, very, I mean,
I
when
actually
you
was
really dial into the crux of it, you have to do it right here in this setting.
Yes.
So these are kind of like the acute scenarios, right?
Right,
But then
right.
there's also, 'cause as we were talking before we started filming, there's also a huge kind of swing to prophylactic IV therapies.
Right.
And so that was kind of what I wanted to get into.
Okay.
This is a unless you were drinking last night, I wasn't.
Nope.
This is a prophylactic IV therapy, right?
Essentially, yeah.
To just kind of help boost things. And so I wanted to get into kind of what we're doing, what the options are, what's on the menu, and the supplemental treatments, which a lot of people don't know about in terms of things like glutathione, NAD, other peptides.
Right.
So, because this is something that my good friend turned me on to a little over a year ago, and we've just been going kind of crazy with the
Right.
And it's a rabbit hole.
peptide
yeah.
injections.
Yeah.
Well,
Deep.
there are hundreds and hundreds of peptides
Hundreds.
potentially that you can use. So I wanted to just kind of go through sort of preventative IV therapies that you guys offer.
Okay.
Who should have them, and why?
Everyone.
Okay. And why? And
Right.
like kind of like and like, how do you determine, or how do I determine, or how does an individual determine for themselves what they should be getting? Because there's a limitless number of things, but like,
Right.
like some of the more common things are BPC 157, Testmorelin,
Montse.
Montse,
Yeah,
Hexerelin. So just to before we get sucked into the peptide rabbit hole, the prophylactic or maintenance IVs. The way I like to think about it is soaking a sponge. Okay. There's a limited amount of bioavailability you're going to get from daily vitamins.
And
Okay?
food.
And food.
They've engineered everything out of our food.
I mean, you talk about oral supplements and stuff,
Correct.
Right? Because
Correct.
That's the other aspect of it, which which I've also been, knee deep in.
Right.
But this is complementary to it.
Correct. But the way I like to think about it is giving your body the maximum amount of, or the most reasonable amount of supplements, antioxidants, vitamins, what have you, on the front end in a, not too often time frame, once a month, once every 3, 4, 5 weeks, something like that, where you're going to give your body, give your cells, the option to take in as much as they want and or can at a given point. So even if you're not ill, it lets you sort of fill the tank from a
Peak performance, as it were.
from a physiology perspective.
Okay, so why can't, and this is a loaded question,
Yep.
why can't the average person do this on themselves, either with a good diet, adding supplements, or even adding self-administered injections? Why IV therapy?
Couple things. One is, as far as food goes, no one has a diet that is sufficient
Agree.
in nutrients, micronutrients, vitamins, what have you. And part of that is what we all eat, and the other part of that is what is reasonably accessible, right? So, a head of broccoli does not have in it what a head of broccoli had 30 or 40 years ago.
Because it's been genetically engineered out of it?
I wouldn't even necessarily say genetically engineered out of it, but it's, the soil that it's growing in is not as robust as it was. It's pulled out of the ground earlier. It's shipped hundreds of miles away. It's sprayed and washed and what have you. And then on top of that, most of us aren't eating much broccoli. You're eating 3 or 4 bites next to whatever that
Pound of steak.
next to that pound of steak.
Yeah.
So from food, in an ideal world, a person could do that. They could get everything they need from a really amazing diet, but that's just not the world we live in.
Right.
As far as oral supplements go, it's very difficult to find both high quality supplements that have enough of the things that you need in a formulation that's both rigorously tested and bioavailable.
And affordable.
Yeah.
Yeah.
So that's the tricky
they're
spot.
They're all super
I always
expensive.
like to tell people, if it's more than $1 a day, it's probably, you really need to look at it, because you can very easily get yourself, and we have clients and I have friends who will open up their cabinet, and you're talking about, $8, $9, $10 a day of just vitamins, handfuls and handfuls of vitamins.
Oh, yeah.
And they're,
Have you been to my kitchen?
We do
So-
have a client that has literally a room probably this size, top to bottom, with vitamins.
yeah. And
And I'm like, well, you can't take all these.
you can't take all these, and your body just doesn't absorb them that way. You have all of these gel capsules, they hit your stomach, they start, it's
can't,
just,
yeah.
you're never going to see those supplements in your bloodstream in
Well,
a
no-
reasonable fashion.
Somebody like me, I can't take tons of supplements because I have a really hypersensitive stomach. So I get nauseous, or that's why doing the IV fluids, like even, or like the B12 when I've gotten
Yeah, well,
B12.
The B vitamins in particular are very nauseating.
Yeah.
Oh,
It
man.
tastes terrible.
Whoa.
Yeah. So the IV is definitely a better way for me, or shot or peptides, because like I can't take some supplements.
Right.
Okay, so then I kind of think about this in kind of various kind of groups of people, right?
Right.
There's the young, healthy people who are either training, endurance athletes, as I understand you're an endurance athlete. Or are you a runner?
Triathlete.
Okay.
Don't minimize it. It's an Iron Man. Iron Man.
Okay.
That's different.
And like bodybuilders, right? Like,
Right.
Because they all have different nutritional requirements than people who are not doing that stuff, right?
Correct.
I mean, you're just running at a much higher level and require supplemental. And then you have patients or people/patients who are maybe going through some sort of illness,
Right.
whether it be a cancer diagnosis or some other systemic problem that their body's burning and churning more nutrients, and they have specific requirements. And then I think that I'm a little bit older than you, but people my age, the anti-aging push, which has been like the longevity medicine, which
Right.
has been pushed, which is more of a preventative thing, but I'm starting to stack up the musculoskeletal injuries just because of my age.
Sure.
I know I only look like I'm 30,
Yeah.
but I'm not. So for those, can we kind of go through like those different groups, and that's how I think. I mean, unless you categorize differently.
No, that's a good breakdown. So your young, healthy athlete types who are trying to sort of maximize their performance or their results. Those people, they are burning through a lot more nutrients, and there is a significant, substantial role to allowing them to recover. Because actually, it's in many ways, it's not about the performance aspect and getting everything out of your performance that you put into it or that you want. Is really about recovery. Right. And this would fall in the category of recovery. So after that long run, hard workout, event, what have you, that recovery time, if you can shorten that recovery time, if you can improve that recovery time, then you're able to stack those workouts and you're able to get higher yield out of what you do.
So to that end, and this is kind of what I wanted to talk about in terms of peptides, maybe you can just very briefly tell our listeners and viewers,
Sure.
like, what are peptides? What's their function in our bodies? And what's the benefit of having exogenous peptides?
Okay.
Like peptides that we inject and or orally absorb.
Right. So peptides in general are a string of amino acids. We have lots of different
Hundreds and hundreds.
Yeah.
And hundreds
So
of them.
the peptide, to differentiate, let's say, a peptide from a protein, because a protein is basically a bigger peptide.
Right.
These are smaller strings of amino acid, 12, 18, 40, 50, individual units. And because they're smaller, they don't fold up. Proteins fold up into weird structures. That's what makes them interesting and unique. The peptides don't do that as much, which means you're able to sort of artificially produce them simply by knowing what's involved, to build
Right.
them. You can't really build a protein as well because your body knows how to fold it. It's sort of an origami situation, if you want to say that. So the peptide doesn't have that. So that's what makes it something that could be produced as opposed to some of these more elaborate structures in the body.
Right. And they're basically cell-to-cell signals, if you will.
Exactly right. So that is your signaling. That's how any part of your body signals to another part of your body, whether that's cell to cell organ system to organ system, what have you. And so right now there are 500 or so, named or delineated peptides sort of floating around there in the ether. And there are a lot of them that are very similar. They are
Lots of cross.
yeah. There's a lot of ones that are let's say there's a whole category that are very similar to growth hormone releasing hormone,
Right.
GHRH. These are what they call the ghrelin analogs, and they're all the ones that end in relin.
Like-
And there's, ipamorelin, semarelin, tesmarelin.
Right.
Anti-meridian, uncle meridian, all the little meridians. So, but what it says is that there are many different parts of the body that want to talk to the pituitary and to the upper growth hormone axis and say, hey, we need a little more. We need a little more every day. We need a little more right now. We need a little more, here, there, what have you. And so what has started to happen is these different types of peptides, these different analogs are being investigated to say, how do we take this signaling molecule and complement or supplement what your body is doing, but not enough,
Right.
isn't doing at all, or used to do and forgot how to do.
But like, how do you, like, patient comes in, how do you and I know that, right? Like, there's, in medicine, there's a lot of drugs that are extensively studied and stuff, and
Right.
peptides in order to know, how do we know that the efficacy, if it's actually working, right? Because like a lot of times I feel like, well, I'm injecting BPC. I have no idea if it's actually doing anything. How can you monitor that?
The vast majority of that is subjective, because the vast majority of the data is cell-based or rats and mice, and some of the rat and mice data is very impressive,
Right.
but they're still rats and mice.
Because like the non-scientist listener is going to listen to us talk and be like, oh, that's amazing, I want to try that. Sign me up.
Right.
And the scientist / physician listeners whose evidence base is going to be like,
That's
guys are
nonsense.
These guys are loony bins.
Wackos,
Like, what the
yeah.
hell are they
Yeah.
talking
Yeah,
about?
right.
And I agree with you. It's very subjective. Like, do I feel better after a glutathione infusion? Yeah, I think so, but I don't know if it's actually doing anything. Do I feel better after, I do an IM NAD shot? Yeah, I think so. I think I have more energy, but there's no way to actually measure it, right?
No, in theory, you could do a battery of reportable testing and see where those are. With some of these ghrelin analogs, yeah, you could take someone and do a series of growth hormone testing and whatnot.
Serum levels of some sort.
But what you're really looking for, and again, this is where that longevity wellness situation goes from, is you're working around the edges, right? So if you come to me and you say, listen, I'm still smoking a pack and a half a day, and I'm drinking a fifth of bourbon every night, and I'm eating steak for dinner every night, but I'd like to do, this, that, or the other thing. We're not going to be able to help that. We're just not.
Right.
I like to lower my cholesterol.
Right. Exactly. Correct.
Okay.
But if you're doing the hard work, you've made adjustments, and you've made it an honest effort in all of the usual categories. How do you get more out of yourself?
Right. That's what
Especially when you're in your 50s and 60s, how do you allow yourself to recover? How do you prevent the inevitable overuse injuries? That's where these kind of things come into focus.
I do have something to add to that. My father-in-law, actually, we are using BPC 157 for him for osteoarthritis, and he is doing unbelievably. He's had cortisone shots. I mean, here's what happened. We said, let's try this, see how it does. Maybe it'll help. Okay, I'll do it. So what's he do? He runs out, gets a cortisone shot, then we give him the BPC 157. I feel great. Well, which one was it? I don't know. Quit taking the cortisone shot.
Right.
Last few times we've given him the BPC has not had a cortisone shot. How long has it been? A couple months maybe since his last cortisone shot? He has improved over the last month and a half, 2 months just from the BPC 157.
And for those who don't know,
That's anecdotally.
BPC 157 is a peptide. A lot of people call it the Wolverine peptide because
Right.
it helps in recovery and rebuilding muscle
Tissue
and
repair.
Tissue repair.
I'm guessing cartilage as well, right?
Yeah,
Right.
smooth muscles, a lot. Yeah,
That's sort of one of the sexiest, well-known ones. but
that's like
what's-
number one.
Yeah, but what's interesting about that one is it's actually it's a gut-derived peptide, right? So this is
on the brain gut axis.
right.
Right.
So this is one of those situations where you take something which comes from an area that shouldn't make any sense just on its face. We're going to take this signaling peptide from the gut and we're going to use it to repair a knee or an ankle or a shoulder. But what it shows us is that the body has lots of ways to speak to itself and to communicate with itself that we either don't understand, partially understand, or have yet to really delve into. And that BPC tends to be really remarkable for all of that kind of stuff. And it's just fascinating that it is derived not from the shoulder or the knee or the ankle. It's derived from the gut.
So for the
interesting.
40 to 50-year-old men and women that are listening to this,
Right.
who are looking or wanting to do more longevity medicine, BPC 57's one good option. What other supplement, IV supplements or IM or sub-Q supplements would you recommend for someone, like if you were designing like a
NAD.
longevity plan for somebody,
Right.
what would you guys kind of recommend?
NAD,
NAD.
100%.
And how often? Let's go back to BPC for a second. How often would you, 40 to 50-year-old?
If you're
man or woman-
serious, and
Yeah.
and you do have to have a little bit of money. I mean, it's not cheap and it's not free. You could do an infusion weekly and really get some really good effects. You could do an injection daily.
You talking about NAD? NAD, right.
You could do injections, microdosing daily, if you don't mind doing little shots. That's going to be probably, that's also bioavailable. NAD is probably going to be your biggest and most well-utilized peptide, enzyme, whatever you want to call it.
Yeah, well,
that
NAD
is
is not
good for it.
technically
Right.
peptide, right? It's,
Right.
It's more a unit of energy, if you will, right? It's
Kinda,
it's what the mitochondria in our body
It's cellular.
are using for energy.
It's cellular food, for lack of a better term, is
Right.
what I tell people when they're trying to understand. But what's interesting is a lot of these things, they're in your body anyway, but they're in your body in such tiny amounts, and your body's amazingly efficient at using these tiny amounts.
Micro amounts.
There is an age at which you stop producing at the same capacity, at the same level,
100%.
right? I mean, it's like you
100%.
and I are not making the same
Hey,
amount of
speak
NAD.
for yourself. I make a lot of NAD.
You're an endurance athlete.
He's an elite athlete, though.
No, but like
Sidebar.
we're not making the same amount that we were 20
Right.
years ago.
Not even close.
Right. So we kind of need the supplementation.
Right.
Okay. So NAD is one. BPC is kind of like can be a daily injection if you want. What other supplements are you looking at?
What is, I know that I got from you guys, I got Motzi and some Samorlin.
Samorelin, yeah.
What does that do exactly?
So the Semarelin, all the relins, all the ghrelin analogs, they work in different ways on boosting your body's natural growth hormone. So, a lot of anti-aging longevity medicine will
Yeah.
will circle in a little bit of supplemental growth hormone to basically supplement as your body naturally is making less of that that will supplement it.
It helps to maintain muscle mass.
Helps
right?
maintain muscle mass, helps with sleep architecture, helps with repair and recovery.
I could
But
be wrong.
is that similar to like Testmorlin and Ipamorlin, which
So-
which are supposed to, if I'm not mistaken, decrease visceral fat, like the fat that's in and around our intestines?
So again, that's another one of those situations where you have a lot of different.
It's not a weight loss drug. It's not this. We're not talking about like the semaglutides.
No,
like
No.
not at all.
Wegovy and
Not at all.
that.
What
It's
you're-
totally different.
What you're doing is you're signaling that axis, that growth hormone axis, in different ways. And when you're mimicking the signal from a different part of the body, that's going to cause the body to respond in that way. So, like you said, are you going to signal the body to burn visceral fat more? Are you going to signal it to do neuron repair? Are you going to signal it to do rebuild and repair muscle fibers?
Right.
And that's where the differentiation comes from. Are they all good? Sure. Can you use them all together? You can, but it starts to get into that same situation like having that cabinet full of pills.
Right.
What I always tell people is you start low and slow with one or two of these things, and then you see how you're recovering, how you're responding, and then you can add and or change those combinations to try to see how do you get the responses and the results you're looking for.
What about for people who have a chronic illness, whether it be cancer or maybe diabetes or some other chronic illness where they're just constantly fighting? It could be like rheumatoid arthritis or some other autoimmune phenomenon. What types of peptides would be good for that group of patients?
So you're in those situations, you lean more towards the anti-inflammatory ones. So you have your thymosin, your BPC, your thymosin beta, TB500, which is also this what they call the Wolverine protocol, so that you're trying to help with repair, but also quieting down that inflammatory response.
Thymosin alpha has shown cancer fighting capabilities, for lack of a better term. And then somebody sent me something recently on peptides used in cancer research, and it was using CMV to inject tumors, making the body respond to the CMV virus, cytomegalovirus, and attack that tumor as a virus.
It's sort of a vector.
Without
yeah.
infecting,
right.
which I think is phenomenal. That's incredible. I don't know how that hasn't already come to light, but they're showing true promise with
There
that.
have been for various therapeutics where you use
Right.
viruses as
Right.
vectors for
Right. Well,
treating tumors.
immunotherapy is basically saying, hey, the immune system work, and they're just
Right.
using something very different to stimulate that immunoresponse. I think that kind of stuff is fascinating.
And then what sort of credence should we give to, I mean, a lot of people throw around the term stacking.
There are a few different ways to look at that, but the basic premise is you're using multiple different peptides at the same time or in sequence to get to an end result.
Right.
And there's a good role for that, but again, you always have to be a little careful. When you're getting to these, when you talk to people, you'll meet people that they're on 8, 10, 12 different peptides in these combinations, and you say, "Oh, I feel great." You said, "Okay,
But
but
what's
why?
working? Yeah.
Why do you?"
why do you feel
But the combo, one of the combos that has shown a lot of promise is CJC 1295 with ipamorelin. They both work, they're both ghrelins, they both work on the growth hormone axis, but one of them increases the sort of the amplitude of the pulse, and the other one increases the length. So what you're doing by using, for instance, those two together is you're getting more pulsatile release of growth hormone over a longer period of time. So as opposed to just slow and steady or one big pulse, you're mixing these two things, which are allowing you to get sort of the best of both worlds. Right. There's protocols for that. There's different ways to approach it, but that's one of those explanations. The other ones that go together, like you said, this Wolverine protocol, TB500 and BPC 157, those two go together very well for repair and recovery. Gotcha. They're not they're not coming from the same organ system. They're not the same thing, but they work together.
So we're not talking like 10 peptides at one time. You're talking about like maybe 2, maybe 3.
Look, there are people, you open the right website or the right magazine, and they'll tell you 10, 12. That's the answer. I just,
it's hard to wrap your head around.
I still, after 20 plus years of Western medicine, you have to hold a reasonable amount of skepticism for everything.
I'm with you. So. Well, as I can tell from our IV bags,
are we almost done?
Yes.
We're almost at we're approaching the hour.
All right.
This has been really informative for us. I'm sure our listeners are going to love this. I always ask my guests one question before they go, and now since there's 2 of you, it's 2 questions, but it's the same question.
Okay.
Don't be nervous. Had you, Dwayne, not gone to nursing school and become a nurse, what do you think you would have done with your life?
Oh my gosh, probably been a bum. I don't know.
That is the first.
That's the first.
That is the first.
I don't know, because I look and I'm like, what would have made me happy? I don't know. I probably would have milled around, done jobs. I've maybe been a contractor. I don't know. Looking back,
A contractor. That's funny.
I like that kind of stuff, but I don't know if I would have been so much compelled to do it anymore or as a job. I don't know. That's as honest as I can say is I might have been a bum.
All right, well, had you not gone to medical school, would you also have been a bum?
Statistically, it's very possible.
You're from Pittsburgh, so
it's possible. I'd like to say something funny like a circus clown or something, but I don't juggle well. But my wife thinks I would have been like an accountant because I'm always, everything's
way.
numbers, and numbers. So, yeah, I don't know. That's a really good question. It's a lot of years past to have decided.
Yeah. Well, thanks, guys.
Thanks
barista.
for indulging.
Actually, I think we could have been baristas.
Baristas.
We love drinking coffee, so there we go.
That wasn't even a career then.
You and Dr. B.
Yeah.
Oh, Black Rifle coffee. We'll
Delicious.
talk about that after.
All right.
It's amazing. Have you had it?
Yeah.
Okay, guys, so we got to
All right.
wrap up the show.
Well done.
So if you can go into your camera and tell our listeners where they can find you, your social media.
What's our social media, Dwayne?
Social media, Instagram is at Alpha Hydration, Facebook at Alpha Hydration, website www.ahsiv.com, and then Google. If you
And that's
Google us,
it.
you'll find us.
You'll find
Yes.
us if you Google us.
Yes.
You can chat with us on Google.
And then you guys are based in the Valley.
Yep.
The Valley.
In the Valley, we got
That's
about
like Woodland Hills
Yeah.
area.
Yeah,
Right.
But you
right.
travel. What's your catchment area?
It really depends. It depends on who's willing to go somewhere. We have
I've been
about
to Paso
It
Robles.
depends on how much they're willing to pay me
Yeah.
to drive.
correct. No, we have our nurses will go pretty far,
Yeah.
probably within about 30 to 40 miles of our
Okay, well,
location. So that's
decent.
as for the LA people. That's South Bay. That's as far as not the Central Coast, but
Ventura,
pretty
South Bay.
Ventura to South Bay. Yeah, and then as far
Up
east
to,
as
up to Oxnard and then
yep, and then probably as far east as
the 405.
well, we've been to Rancho. We've been to Rancho, but
Been to Rancho.
but probably your Glendale, Burbank.
Gotcha. All right, cool.
Awesome. Okay, guys. Well, thanks a lot for coming.
Thanks for having us. It was
And,
great.
Thanks for coming on.
Dr. B is going to be having a great weekend.
Oh, my
he's
God.
ready.
Yeah.
He's ready for his weekend.
I don't even know
Theoretically.
what you put in this thing.
All right,
special.
guys. Thank you.
All right, thanks
Take care,
very
guys.
much.
Thanks so much for listening to Beyond the O.R. with Dr. Brenner. Make sure to subscribe, like, and follow so you don't miss any future episodes. In the meantime, hit me up on Instagram, Twitter, and TikTok at Kevin Brenner MD and KevinBrennerMD.com.